Psychedelics House of Davos. So we wanted to kick off today with a conversation that we've been having a lot with a lot of different folks and people who are coming into the house and asking, how do I actually access psychedelic assisted therapy? And there's been a lot of different ways that folks have found access, whether that's been through clinical trials, whether that's been through traditional psychotherapy and being prescribed ketamine-assisted therapy within the United States. Some individuals are looking at the future of consumer packaged goods and CPG, while others are looking at the growth of the retreats industry. And so today we wanted to have a little bit of a conversation on all of these different ways, pros, cons, positives, negatives, ethical concerns in the rollout of psychedelic-assisted therapy and access to psychedelics in other contexts as well. So I'm going to hand it over to Liana, who will be moderating this panel. Thank you guys for joining us and enjoy.
Thank you so much. Oh, is this thing on? Okay, great. Marie, thank you so much, and so many thanks to the Tabula Rasa team, Maria and Maya. It has taken a lot of bravery and boldness to bring this space to Davos, and I have to say it's been really fun walking around town and mentioning that I'm part of this endeavor. It's really raised a lot of eyebrows and started some fascinating conversations. So it's wonderful to be here in Davos and to be here with all of you. My name is Liana Sananda Gillooly. I work with MAPS, the Multidisciplinary Association for Psychedelic Studies. And today I'm playing the role of moderator. And Marie just mentioned the different ways that psychedelics are becoming accessible today to the many people that it stands to help. One other arena that he did not mention was the religious use and access to psychedelics, which we will not cover today because we do not have a representative of that arena on our panel today. So starting out with medical access. So MAPS is currently completing a phase 3 trial. We're looking at creating prescription access to MDMA-assisted therapy as soon as 2024 in the event of FDA approval if all goes well. Currently today, there's a huge explosion of ketamine-assisted therapy and ketamine clinics popping up all over the United States and other places around the world. And so I'd actually like to start, we have 2 representatives here today who are working in that vertical, and I'd love to start off by inviting Klee Irwin to share a little bit about who you are in this world and in this space, and your project of creating access to care and treatments through rolling out ketamine clinics.
Yeah, we're trying to leverage the power of our brand. So we started 28 years ago and built a brand in health and wellness in the herbal nutraceutical space. And so at least in Canada and the US, we have a household name familiarity in the market. And so there's some trust there. So we think that we can lend that brand or leverage that brand into an expansion in the form of a chain of psychedelic mental health clinics called Irwin Naturals Emergence. So we're not completely reinventing the wheel. There are 600 ketamine clinics out there, and so we're selecting ones that have good bedside manner and good practices, and we're mainly interested in lowering costs, so we can centralize insurance billing, we can use efficiencies and best practices to get pro bono treatment for people that don't have any income, and then sliding scale discount for low income people. So that's what we're doing, and we're asking these independent ketamine clinics to sort of join the family and come under this sort of syndicate or umbrella brand of Irwin Naturals Emergence to eventually get to significantly lower patient costs and without compromising quality.
Klee, just a quick follow-up. You mentioned cost. Could you share with the audience what a ketamine treatment round or series currently costs in the United States?
Yeah, it's there's a pretty wide bandwidth. Johnson & Johnson makes a nasal delivered form of ketamine called S-ketamine, and insurance companies are paying, in the range of $900 or more for that. When people pay out of pocket for intravenous ketamine treatments, it can cost $300 to $800 per session, and typically 5 or 6 sessions over several weeks. So it costs a few $1,000 out of pocket. And so the problem for me is that ethically, some mental illnesses track to trauma, violent trauma, other types of trauma, and some types of trauma track to income. So if we have those in our society at the lower income levels who need this treatment the most, we need to kind of step up as corporations and have a B Corp kind of mentality to figure out how to step into the breach and provide relief while insurance companies are still not yet, fully paying for this, miraculous, set of treatments.
Great, thank you so much. Next we have Ronan Levy from Field Trip Health. And Ronan, I'd love for you to share a little bit more. 600 clinics in the United States, that's a lot, right? And so there's some clinics that are doing ketamine-assisted therapy and some that are just providing ketamine as more of just an intervention without the therapy or psychological support. I'd love to hear a little bit more about what you're doing at Field Trip, and maybe you can also comment on the status of insurance coverage.
Sure. So as Liana talked about, there's kind of two approaches that we're talking about here. There's multiple approaches. There's just taking drugs for fun, which no judgment, that's one option available for people. There's using ketamine or psychedelics purely as a medicine in a very conventional sense of how we're used to medicine, is you take medicine and hopefully you feel better and then you move on. And that's how most ketamine providers are providing it. They're providing it as an IV infusion. You receive the ketamine, you feel better for a little while. It looks like the evidence suggests it's about 3 weeks till you revert to the mean. So you have about 3 weeks of benefit, which is great. It's nothing to shake a stick at by any stretch of the imagination. And then there's using psychedelic assisted therapies, which is pairing the psychedelic, whether it's ketamine or MDMA or psilocybin or any other ones, very closely and integratedly with psychotherapy. So not only are you getting the biochemical response from the medicine or the compound, you're also taking the consciousness and neuroplasticity opening that follows the experience and really trying to change behavior, attitude, outlook. And that's exactly what we're focused on at Field Trip, where we're focused on ketamine-assisted therapy. So it's deeply interwoven into our process. That therapy is a part of it, and I know that's how MAPS conducts its trials, and many of the trials are being done that way, and I think that's where we're seeing the best results. At Field Trip, we're seeing the average person improve from severe depression scores to mild depression scores, same with anxiety, and those benefits lasting for 120 days or longer. So significant improvements for a long time, which is really amazing. The challenge with it, and to Klee's point, is that when you're talking about psychedelic assisted therapy, you're necessarily involving many professionals who have a lot of experience, who tend to bill at very high hourly rates for a lot of time as part of the process. And that is what drives a lot of the cost, whether it's at a retreat or in a clinical setting. It makes it more expensive. And I think that's one of the challenges we're all trying to navigate, is how do you make this accessible from a cost consideration perspective. Right now at Field Trip, it's about $750 to $1,000 per session, which is out of reach for way too many people, and we're trying to work to figure out to enable access and lower costs, but it's kind of the context in which we're in. And there is not a lot of current insurance coverage, although we are working with organizations like Enthea and Dr. Bronner's to enable insurance. One of the big challenges with ketamine, which hopefully will be resolved with MDMA and psilocybin when they have specific approvals, is that ketamine's a generic drug. It's been around since the 1970s. It's a very effective and important medicine, but because of that, no one's conducted the clinical trials to apply it to mental health applications. And so the steps to get insurance reimbursement are actually just a long road to hoe. And just from an economic perspective, there's not a lot of incentive for any one organization to do that. But I know the MAPS is working very aggressively to enable insurance coverage. So we will see it come, and for people who are interested in it, there's some degree of reimbursement if you have extended health benefits, because the psychotherapy aspect of our treatments tend to be covered by insurance, but the actual ketamine is not. Did I touch on everything you wanted to get on?
Do you want to just speak a little bit more about the type of package that Enthea is working on and what they did with Dr. Bronner's?
Yeah, so I don't know all the details. It hasn't been directly in my focus, although I did speak with Leah a lot. Dr. Bronner's, the soap company, I don't want to do disservice just calling them a soap company because there's so much more, but just to give some context, has been working with an organization called Anthea. I think they just converted from nonprofit to profit, but I'm not 100% sure.
They're working on that conversion right now.
Yeah,
Into being a PBC.
To enable policies such that employers can actually apply and provide coverage to their employees, and so that's what Dr. Bronner's is doing. We're currently getting our San Diego location field trip covered and approved by Anthea, so that should be positive, but I don't know the cost structures or what happens with that afterwards.
Yeah, I think insurance coverage is just incredibly key to unlocking access, and to both your points, it still leaves out a huge amount of the population, especially here in America. Right now, we're really focused on talking about rolling this out in America with these two examples, but so many people in America do not have access to insurance coverage, and even if they have insurance, they don't have access to coverage for mental health treatments, right? So we have a huge hurdle when it comes to patient access. I'll just quickly share that MAPS has started a patient's assistance fund. So in the event of FDA approval, we're able to subsidize the cost of therapy for people who might want to gain access to MDMA. We share the same concerns, right? We're talking about 2 therapists in the room for 8 hours at a time. That's a high intensity and cost up front, but the overall healthcare economics and the savings on the healthcare system are incredible when you're talking about people who have lived on average with PTSD for 14 years, which is the average in our studies. So if we can get people help now, it'll have a less overall impact on the entire healthcare system. Do you want to add anything?
I was just going to say, that's one of the somewhat frustrating things with this dialogue, because you have the base level reason for doing that. All of us are doing this, which is just the humanitarian considerations, is helping people feel better, right? But then a lot of people are able to go back to work, which is what drives a lot of the economics of, I know, the MAP study that came out. But then there's also increases in productivity, because not only are people going back to work, they're more productive and they're more creative. In terms of the economic considerations stacked on top of the humanitarian considerations, it's mind-blowing that not more and more people are jumping on the bandwagon. They will, but it's such simple math that it's mind-blowing that it's not going faster than it has been.
Yeah, no, we haven't received, funding from institutions like NIMH, the National Institute of Mental Health, for research, right? When we have this great economic case, people are more active in their families, they participate in society, there's a huge amount of benefit to creating this healing. So, Laura Dawn, I'd love to turn the conversation over to another vertical, another way that people are able to access psychedelic healing today, which is in the context of retreats. And there are retreats popping up all over the world, and there's huge questions around affordability and the quality and differences in retreats. But I'd love for you to share a little bit more about the landscape of retreats, where it's available, and about your work.
Okay, great. Thank you so much.
Yeah.
So my name is Laura Dawn. I'm the founder and director of Grow Medicine, which is a project of the Indigenous Medicine Conservation Fund. I'm also the host of the Psychedelic Leadership podcast, and I have a master's in science in a program called Creativity Studies and Change Leadership, and I focused my degree on the intersection between psychedelics and creative problem solving and creative thinking within the context of leadership development. I also built a volcanic hot spring retreat center on the Big Island of Hawaii, and I've been in the retreat space for about 10 years. And yeah, this is such a huge area to unpack. I guess really when we look at the retreat landscape, a lot has changed in the past 10 years. There's been so much exponential growth in people stepping out and leading and facilitating retreats. So I guess some of the place I might start is just looking at being really aware that you have the power to do due diligence. So I'm really speaking to the average everyday person. I get so many messages and emails, always asking me where is the best place to access these experiences. And, in the US, they're not legally available yet. So a lot of people are traveling abroad. And there are some big considerations that we need to remember. That first of all, even traveling abroad makes it a high bar for accessibility. So not everyone can afford an experience like that. and really asking the people who are leading retreats. I think one of the most concerning things that I've seen recently is that people who are very new in the space are now stepping out to lead retreats, but they're sort of justifying it in the sense that they're bringing in other people to facilitate. But these people who are preparing you for that experience, or lack of preparation is really what I'm seeing, lack of preparation, lack of integration, they're sort of relinquishing responsibility because they're bringing in a quote-unquote shaman to, facilitate the experience. So some of the big red flags to be aware of is actually how much experience does the team who you're paying to be at that space, how much experience with medicines do they have? What's the relationship they have with the facilitators that they're bringing in? Do they have a medical intake form? Are they offering preparation and integration support? What kind of safety protocols are they thinking about? How big is the group that they're bringing? How many assistants do they have for the ceremonies? Where are they sourcing their medicine from? This is a really, really big question, especially, and I'll just say that there's very specific questions depending on the medicine that you're going to work with. For Iboga retreats, do they have a medical person available or a nurse practitioner? Where did they receive their Iboga medicine? 90% of Iboga is harvested illegally in the wild, and it's putting a lot of pressure on the communities in Gabon. Do they have a relationship with the person sourcing their medicine where they're really, contributing to the communities that have a deep relationship with that medicine? And so just encouraging people who are thinking about going abroad, we have a responsibility to become aware that when we go into foreign countries, we have an impact. Ayahuasca tourism does have an impact on a lot of communities. And so if we want to be good stewards of these medicines and good people in the psychedelic space, we have to remember the principles of do no harm and think ahead. Okay, what is my impact if I go to a community in Peru or Ecuador or Costa Rica, which actually is one of those gray areas? A lot of people think medicine is legal there, but actually it's still more of a gray area. That we have to remember, what is my impact and how do I take responsibility for how I'm in right relationship with the territory, the sacred territory, the communities that live there, the original peoples that have been stewarding these medicines. And so all of these concerns, I think it's really important for us to remember. And I'll just name a few resources because there are so many questions that I get asked all the time. I created a free guide. So if you go to lauradon.co/downloads, I have a guide, 45 questions to vet your facilitator, shaman, and retreat center. And sometimes we just have to remember that there are things that we don't even know to ask. And I've traveled to other people's retreats and been so blown away by just the lack of thoughtfulness, where teams are bringing in shamans from Peru and they don't have anyone who even speaks Spanish on their team, and they've never worked with this person, and they felt it was disrespectful to ask what's in your medicine, I don't consume a medicine at a retreat unless I ask what is in your medicine, because some cultures put in plant admixtures into ayahuasca besides ayahuasca and chacruna, for example, that have really strong contraindications. And was the medical intake form reflective of that awareness of what medications they might be on that are contraindicated with any other admixtures? So there's so much to be aware of. And if you are going into the jungle, asking the facilitators, how do you handle emergencies? And do you have someone trained on your staff that can handle more in-depth support for trauma, for example, a trained therapist? Not that we necessarily need that, but just really understanding the depth of experiences that they have. How many retreats have you run? Have you even run it at that center before? Are you familiar with the space? Is there a safe room? All of these little details that really people don't even think to ask. And that's just the tip of the iceberg. I could go on for another hour. And I'll just say another resource, Dr. Pamela, I don't know if it's out yet, but she was working on another guide, 101 Red Flags. So maybe just Google that and find that as well. And then you were mentioning too, the Chacruna guide has a preparation for ayahuasca experiences. But again, all the different medicines are so different. So just knowing how to prepare for that and planning ahead and really giving yourself a lot of buffer time to integrate at least a week. If you're going to an 8-day ayahuasca retreat where you're going to drink medicine 4 times, like at least a week on the other side. and calling in support for integration now.
Yeah, thank you so much. Yeah, all of those points are incredibly important as more and more people become aware of and are curious about having these experiences. Like, we cannot up here stress enough that these are big experiences and they require a lot of safety and consideration before you jump into something like this. So you mentioned the legality, right? And there are a few countries that have shifted drug policy reform. There's other countries that have always had legal truffles, for example, in the Netherlands that are doing retreats. But I do want to highlight the role of drug policy reform and the fact that even in the event of FDA approvals and the expansion of access to medical ketamine, that the majority of people are still going to be accessing these experiences in a recreational setting, right, amongst their peers and amongst their friends. And so I'd love to kick it over to maybe Ronan and whoever else might have a comment, but just this conversation around the importance of public education on safe and responsible uses of psychedelics. Maybe we can start with you, Ronan. You can share a little bit more about what you're doing with the Trip app.
Yeah, absolutely. And to your point, the legality, like, we should be clear, psilocybin, MDMA, LSD in most jurisdictions, they're still scheduled. In a couple of jurisdictions, they've been made legal. In most legal environments.
I want to correct that.
Not
They made it the
LSD.
lowest priority of law enforcement, okay? So in
yes.
certain cities in the United States, there's a movement called Decriminalized Nature that has decriminalized access to plant medicines and fungi by making it the lowest priority of law enforcement to enforce those laws. Just quickly, sorry.
That's right. In
Yeah.
the U.S., with the exception of the state of Oregon, which is in the process
Yes.
of creating the first legal market for psilocybin services, which I
Yes.
think is well considered and thought out, so that's pretty exciting. And then, in jurisdictions like Jamaica, psychedelics are not illegal, they're not legal, they're just unregulated. Same actually with the Netherlands, where psilocybin truffles are just thought of as a food product. So, you should definitely want to understand the legal landscape, because that's one of the factors you have to consider if you're exploring anything outside of a purely medically prescribed access. One of the things we did at Field Trip, actually not immediately, but is inspired by the first decriminalization effort in Denver, is we realized that we had built these really robust and thoughtful protocols to support people through their ketamine-assisted journey experience at our Field Trip health centers. But following on Denver and just general cultural trends, we saw that there's going to be a lot of people going out and doing this on their own. Let's not be naive that just because it's decriminalized, a lot of people aren't going to use that as a ticket to be like, oh, cool, this is now legal, I can do whatever I want. And so we took a lot of that thinking and put it into our app, which is called Trip. We're going to rebrand it as Field Trip, which is designed as a protocol for anyone who really needs a very simple and approachable. And I certainly agree with Laura, like, being responsible is the right thing. And if you think about the word responsibility, it is the ability to respond, which is collect information, digest it, and respond accordingly. But a lot of people aren't going to be responsible enough to read, 45 questions or all those red flags. They just want a tool that they can use right now. And so we really tried to build something that was simple and accessible and easy to use. And so it takes you through an entire trip flow about how do you think about preparing? What questions should you ask yourself before going on a psychedelic journey? Even if you're working with a therapist or a facilitator or a guide, these are still useful questions to ask yourself. We have music designed specifically to support a psychedelic experience. Generally speaking, it's a bad idea to listen to heavy metal during a psychedelic experience. Not always, but you want to have music that properly supports it and can really enhance the experience. And then we provide people with questions and meditations to start to do the integration work. I absolutely agree that taking a long time after a retreat is a good idea, but from my perspective, integration is a lifelong process. It starts well before you go to any psychedelic experience, and it continues for the rest of your life, because the insight and awareness that comes out of it always changes you, will be with you for the rest of your life. Whether you have that afterglow for a long time or not, it's a lifelong process. And so we really want to start people on the journey, but what questions do I ask myself? How do I think about this? Who should I contact if I'm getting out of my league? These are all the things that we're doing with our Trip app, and the response has been amazing. I mean, with virtually no marketing support and very little funding within Field Trip to build it, we've grown to about 75,000 installs over the last 18 months. And now we're going to make it much more front and center, because so what we were talking about before we got on stage, this is out there, you know, like in the 1960s when it left the lab and it left the clinics, this has gone mainstream. It's probably, I've heard it be described as the worst kept secret in corporate America. And so we really want to empower people to take some degree of responsibility and have the tools to support it. So that's what we're doing with Trip App. Sorry, that was a very meandering kind of answer.
It's great, it's very important. I'll just quickly add that MAPS is developing a training right now called Psychonautics 101, and it's going to be a 15-hour course, so kind of on the more intense end of training, and it's really to encourage anyone who might want to explore with psychedelics to have an in-depth understanding and knowledge of how to do so safely. We've been doing harm reduction services for a long time through the Zendo project, but this is the first time that we're also able to speak openly and freely about how to dial in the experience that you're about to have. So does anyone else want to comment on any of the other, I'm curious as well as companies, if you are taking positions on drug policy reform, right? When we're talking, you mentioned, right, that we're talking about the harms. The war on drugs has caused an incredible amount of harm and distress and suffering, particularly to Black and brown people in the United States. And I want to name that this is an all-white panel here. We're going to get to questions in just a few minutes. And so when we're talking about these expensive treatments, right? And so MAPS is doing what we can. We have a focus on training therapists, providing scholarships for training to therapists who work within marginalized populations already, so that on the day one of MDMA approval, that people are able to access therapies from people who share their lived experience and they feel connected to. So that feels really important for us. But I think this question of inclusivity is not just, are these treatments affordable, but who feels like when they read and learn about this, yes, this is something for me. This is something that I feel like can help me. So I'm curious how each of you are thinking about inclusivity, accessibility, and issues around the drug war and racism and all these things and how they intersect with this movement. I'm not sure who wants to start. Maybe Klee?
I personally think that any plant medicine that's been indigenously used anywhere on the globe that does not have a chemical mechanism for addiction should never have been made illegal. Now, if there's some plant substance like heroin that has a chemical mechanism of action for addiction, that's a different story. But psilocybin, and these plant-based hallucinogens and psychedelics that we're talking about, I think they should be legal. And I think that there's this place for the professionals to do psychedelic-assisted therapy and get the insurance industry to cover it, and that's one silo. And then there needs to be freedom, in my opinion, for people to use substances to alter their consciousness, as long as it's not going to destroy society, right? Like if everybody was addicted to crack cocaine, okay, maybe there's a great reason to make that illegal. But I don't think that type of thing was ever, that level of abuse was never the case with these plant medicines. So it's a travesty they were ever made illegal.
Yeah, thanks for sharing that. I'm at risk of talking too much, but I just want to share that I believe all drugs should be decriminalized, and that the reasons why people become dependent on substances have a lot more to do with trauma and socioeconomics than policies, right? And I feel like this distinction between like the good drugs and bad drugs, and Dr. Carl Hart wrote a book about this that I recommend called Drug Use for Grown-Ups, might not be like of most benefit to all people. So I just want to personally name that. And Ronan, did you have something?
We just had we're making a documentary right now called Ordinary Trip, and we had Carl at a dinner, and so he was talking quite passionately about that. And I agree. I mean, like, my favorite thing coming out of the last election in the U.S. was not the fact that Donald Trump lost, but the meme that went around that said, "Congratulations to the drugs for winning the war on drugs." And so I'm a big believer as well, which is like in Canada we're slightly, I think, more progressive on this, and we have clean needle sites and all of that kind of stuff, and it just makes sense. No one's stopping people from taking drugs. The best thing we can do is educate and ensure safety of supply, and that's it. Putting people in jail is really terrible idea. And if we've learned anything over the last 60 years of the war on drugs, it's a really terrible policy idea. So I'm a big advocate for drug policy reform. I think it's important. I think it's sensible, even outside of this conversation, that what we've done doesn't work. So let's change the dialogue and try something else.
Yeah, I'd love to comment on this as well. I think it's just really important, especially being an all-white panel, and we don't have Indigenous representatives here, and I don't want to speak for Indigenous people, but I have learned an enormous amount working with the Indigenous Medicine Conservation Fund. And I think one thing that we should deeply consider is that when we're talking about a medicine that is embedded in a way of life for Indigenous peoples, that actually we should step back and allow these Indigenous people to actually have a say and lead the discussion on how their medicines are being decriminalized. And I know this is a big conversation around peyote, for example. And I really think that we really should be thinking about that actually the movement to decriminalize peyote does have a huge impact on the Native American church. And because they've been stewarding these medicines for very much longer than we have been engaging with them, that actually they should be leading the discussion on how their medicines are being talked about and the policy reform around that. And same with the other medicines as well. If they are embedded in a way of life for the traditional knowledge holders who have been stewarding these medicines for a long time, that it's not our place to be stepping out and leading the reform and the policy and the decriminalization movement. I think it's different with MDMA and other substances, that there's a lot of nuance there. But when it comes to, peyote, for example, that we should take a step back and allow the Indigenous leaders to lead the conversation.
Yeah, could not agree with that more. So we have reached time. I do want to turn it over to questions. Yeah, I want to leave with just a quote that a friend of mine named Tristan Harris, he made the film The Social Dilemma. He shares this quote in the film, which is that we have Paleolithic brains, we have medieval institutions, and we have godlike technologies. And he's talking about the role of Facebook in our world. But I think the same quote applies to psychedelics. And so when we're wielding this godlike technology, I'm constantly questioning what is the cultural context and delivery alongside these treatments, and how can we develop the wisdom to hold possibly millions of more people coming online and trying psychedelics for the first time. And I think that question remains unanswered, and we have a lot of work to do culturally around this. So, did you want to say something?
Yeah, 2 resources that I think would be really great to mention. Fireside Project, just for anyone who's watching this after this, where this is live, if you're working with psychedelics and you're having a hard experience, you can download the app and call Fireside just as an easy button, and they do peer-to-peer psychedelic support. And also, I just want to name the Ancestors Project and encourage people to donate to their accessibility fund, because I do think that we, as more affluent and we have resources, so let's share those resources, share those benefits, and donate to that fund so that more people in the BIPOC community can have access to these experiences too. So I just wanted to name those 2. Thank you.
Great, thank you so much. Do we have any questions in the audience? Yes.